This is my pathogen presentation project on Streptococcus pneumonia. In this, we will be talking about the morphology, where it's found, the virulence of the organism, transmission, prevention, treatment, and why we should know about it. Morphology is the first topic that we are discussing. This is the study of the form of things. This is a gram-positive bacterium. It is usually seen in pairs of cocci and is a facultative anaerobe that is an opportunistic pathogen. This is responsible for the majority of community spread / acquired pneumonia found in the respiratory tract. Where is this normally found? It is commonly found in the nose, throat, eyes, and ears, oral surfaces, also known in the respiratory tract, such as your lungs. In this diagram, it shows you the colonization process to then being exposed, and then where it can go from there, such as the infection, either pneumonia in your lung or meningitis, just depending on how the bacteria spreads. Virulence of an organism, which is the severity of harmfulness of the disease or poison to a human's body. It does secrete toxins to factor against the host cells, but does not produce any enzymes. One strand has a capsule and is more virulent, while some strands do not have capsules and aren't as virulent. Now we're going to talk about transmission and how it is the action and process of something going to something else. So how do we get it into our bodies? The bacteria typically spreads from person to person by direct contact with respiratory secretions, such as saliva or mucus. People also get it by autoclination in persons carrying the bacteria in their upper respiratory tract, so if they cough or sneeze and you're around them, it's a possibility that you can get whatever bacteria they have going on and get an infection. Now the type of infections that it causes, the most common infection is in the middle ear, such as sepsis. This is known as a blood infection. Along with pneumonia or meningitis, which is inflammation in the brain and spinal cords and can cause respiratory issues. Signs and symptoms. So symptoms include fever, cough, shortness of breath, chest pain, stiff neck, confusion, increased sensitivity to light, joint pain, chills, ear pain, sleeplessness, and irritability. These can also be confused with many other infections that you can get in your body, so you have to get treated for it and diagnosed with it correctly. This disease in severe cases can cause hearing loss, brain damage, and death. This can happen if the disease isn't caught early on or proper treatment steps weren't taken. Prevention. How can we stop this from getting into our bodies and being around people or while we're working in the OR and not even knowing how we can get it? There are two types of vaccines for the virus. One is pneumococcal conjugate vaccine. This protects against 13 types of bacteria. Typically get this vaccine as a child and 4 doses of it at 2, 4, 6, and 8. And the other is pneumococcal polysaccharide vaccine, which this was the first vaccine to come out against pneumococcal viruses and covers about 23 types of bacteria and is mainly for capsular bacteria. Treatment. So if we get this virus, how can we minimize the symptoms and get us to feeling better? This responds to penicillin 1 million units through IV every 4 hours, ampicillin 1 gram every 6 hours, or ceftriaxone 1 gram every 24 hours. Sometimes if you get this frequently or even one of the antibiotics in your bloodstreams frequently, the bacteria can become resistant to certain antibiotics, so you'll have to try a different one if it doesn't relieve your symptoms. Why should surgical technologists be aware about this microorganism? It is a potential to catch this bacterium while working in the OR without even knowing it. If you were to be working in the body cavity and get something on your hands and then touch one of your oral surfaces, or be working in close contact with people that cough or sneeze near you and they have the bacteria, just to be aware and that you are well protected if you were to get and know the treatment options as well. And last but not least, this is my bibliography and where I got all the information from.